Hello, my name is Stephanie Caballero, and I will be doing my presentation on HIV. So, why does HIV exist in our society? Well, the human immunodeficiency virus, HIV, is believed to have originated in Africa and had been transmitted by having come in contact with an infected chimpanzee species, by consuming their meat and handling their infected blood. Now, with the first humans having the virus been discovered around the 1960s, there have been experiments that had found that it could have been introduced as early as the 1940s. However, in the United States, the first cases came in the mid to late 1970s when people who would normally have healthy immune systems were frequently being diagnosed with cancer, pneumonia, and other illnesses. And because of this, it was later expressed as HIV that had been the cause and that had taken over the immune system of many people it had already affected. How and where did this problem happen? It is originally a virus that had developed in chimpanzees, which was called the simian immunodeficiency virus, SIV, which had then mutated into HIV once they had infected humans. And since the people would use the chimpanzees as a source of meat, the infected blood that they would handle and then consume is believed to have been how humans contracted the virus, since HIV is transmitted through bodily fluids such as blood, semen, and urine. HIV's origins are believed to have come from West Africa, where the people had become infected from a certain type of chimpanzee that they had hunted. So on from this encounter with the chimpanzee's infected blood, the people would then pass on the virus to others without knowing until it reached other parts of the world. Risks for the community and etiological factors. For the community, without being screened for the virus, there is an increased risk amount of people contracting HIV, meaning that without acknowledging that the virus is there, it will continue to spread, as well as misconceptions of HIV and how it is contracted and or passed on to others, leading people to feel discouraged to get tested, creating a greater health risk for others. And etiological factors, having unprotected sex with multiple partners, as well as being pregnant and giving birth to a child while having the HIV virus, sharing and using unsterile needles for drug usage, and having other sexually transmitted infections prior to have obtained HIV. How to solve this public health problem? A strategy that can help solve this issue for HIV is to ensure that people are educated on the matter, including infected and uninfected people, so that misconceptions won't interfere with people receiving the necessary treatment. Another strategy is giving people better access to resources that can educate the public of how to keep HIV from spreading and providing those already with the virus resources that they need. Examples. Although the issue with HIV has not been entirely solved in other countries because a cure has yet to be discovered, the educating of people of the risks of getting HIV and what methods are best to lowering the chances of getting the virus, such as in Thailand, where they had informed people to not have sex with sex workers because that was their main cause of getting HIV, and decreasing the amount and using protection would then also decrease the amount of people who had gained the HIV virus, leading to many people and the percentage of people having HIV to decrease, as well as enforcing the best ways to prevent the virus from spreading to create a significant decrease in the people who contracted the virus, such as in Thailand, how they had informed the people of the cause and how to prevent it. They had prevented more and more people from getting the virus, decreasing the chances of others getting the HIV virus. Public health in the future. To prevent the reoccurrence of this public health problem, people all over the world need to be educated of the risks and also need to be informed of the misconceptions of people who have HIV, as in making sure people understand ways the virus can be actually contracted, and this way people are more likely to get screened without feeling as though they have been scrutinized by others or their family members, and this will decrease the amount of people who become infected with the virus. In my opinion, the prevention of HIV being a public health problem in the future is that it is necessary and that it would be beneficial for all people across the globe who are at risk and are already infected. As in this picture, for the prevention of HIV, abstaining from sex before marriage will be helpful, as well as being faithful in said marriage, and using condoms as a protective barrier, and avoiding using drugs or an excess of alcohol, and early detection, getting screenings, and being treated for other STIs if necessary would be helpful in decreasing the risk of HIV for future generations to come. In this slide, I have the references I use for the rest of the information I have in the rest of my slides, and that is all.